Hello, this is Dr. Berger from the Meguro Counseling Center. Thanks for coming today. How can I help you?
Well, my wife and I don't get along. I seem to be aggravated easily, and things escalate. We are in our early 40s and have 3 kids, and we don't want to get divorced.
I see. Tell me some of the details.
Well, I tend to get irritated by her if she is slow or doesn't quickly understand what I say. I work in a fast-paced office and seem to bring that home to her.
Have you always been this way?
Yes, I've always been a bit irritable and intolerant. Always need to be on the go, doing something important.
Have you ever had depression, trouble focusing or organizing yourself?
I've never had a depression, no. I'm quite focused and organized, intensely so. I did very well in school and do very well at my job.
I see. Seems you can't easily relax and your wife's life speed aggravates you. You get irritated at her and then she wants to fight back with you.
Yes, that's it in a nutshell.
What about risky or impulsive behaviors?
When I was a teenager, I tended to ski fast and do risky skateboarding. The only thing I seem to do now is that I go to the bad parts of any city I visit and run to the local bars and talk to the people there. My life in a corporation seems a bit sterile and I can't stand that.
Right. Most persons your age and in your position at work and with a family wouldn't take those kinds of risks. But you seem logical and soft-spoken now.
Well, I realize the risks, but don't seem to be able to help myself. I'm usually calm, but the motor in me to do lots of things is still there. I've never been obviously manic, running around, unable to relax, lose sleep, or have racing thoughts.
What's your family of origin like?
My mother seems scattered, constantly making notes on small pieces of paper, but she can't handle anything related to even simple mathematics and doesn't understand simple household finance. My dad, he was an engineer and very bright. My brother is also bright, but he never seemed to have the patience to study. He works at a warehouse and tends to argue with his boss a lot.
I see. Thanks for the concise information. Well, today was only a short talk. Naturally, I need to get to know you better. It'll be best to interview your wife to get her side of the story too. You probably know that psychiatry can be a vague science, and it is really impossible to prove or disprove psychiatric interpretations and diagnoses. For the purpose of this educational video, though, why don't we look at what might be going on here and what to do about it. Your irritability, intolerance, impatience, and fast pace began many years ago, clearly not caused by your wife. Your high drive level and high intelligence gave you charisma and compensated for these problem behaviors that seem more physiologic in nature as opposed to some personality style, you see? Personality problems are seen more in interactions with people. For example, wanting to be the center of attention, controlling others, and stuff like that. The kinds of hyperactive and impatient traits you show, they don't themselves lead to personality disorder. You also did not have some psychiatric disorder like depression, anxiety, or manic depression. For now, I would provisionally say that your problem fits along the Attention Deficit Hyperactivity Spectrum Disorder, sometimes commonly called ADHD. It's partially a poor name for this problem because your attention ability is superb when it comes to moving your goals forward. When it comes to patiently dealing with your wife and what you see as mundane household matters, however, you get irritated, and it could be said the sustaining attention is an issue for you. You just never worded it this way, you see? These traits could possibly have been inherited from your family that has hints of this problem in your mother and your brother, but not everyone inherits the exact same problems or the same expression of these problems, and I can't prove that this is absolutely true. Let's take a look at the symptom cluster for ADHD. You may notice that you show almost every one of the symptoms in this chart. The key here is that you don't need to have a clear attention deficit to have the hyperactive type of this disorder. For now, I'd like to meet your wife and then propose a plan for you that would include family therapy and probably a targeted psychopharmacologic intervention aimed at boosting your ability to sustain attention to mundane things and thus increasing your patience and tolerance. Thanks for coming today. Just to review, I met your wife, educated her about ADHD, and coached her to be tolerant of your impatience and not to argue back with you. I think this was effective, but she was still under a lot of stress when dealing with you for long periods of time, mostly on the weekend. I then proposed for you to try a medication targeted to help your attention and impatience to take only on the weekends when you had to spend large amounts of time together with your wife. It seems the combination of this medicine and coaching you and your wife on how to interact, for her to realize you could not control yourself and meant no harm to her, and for you to apologize if you did not stay calm and got aggravated, greatly helped your relationship with her. I think so. And there's no more talk about divorce right now. Of course, we spent some time to discuss how to take this medication safely. And while we still not prove you have ADHD, the fact that you are more patient now when taking this medication and that your impatience returns on days you don't take the medication is strong empirical evidence that this is a working diagnosis and is a valid way to conceptualize the issues at hand and to treat it.
Thanks, Dr. Berger. This has been a great help to me and my family.
It's my pleasure to have been able to help you. Thanks for coming. This is Dr. Douglas Berger, Director of the Meguro Counseling Center. On behalf of myself and my staff, thank you for watching this educational video.